Welcome to our next session with Dr. Michael Vallis. Today, Dr. Vallis will be presenting capillary blood glucose, where the rubber hits the road for type 2 diabetes. Dr. Vallis will be discussing the importance of literacy and numeracy in effective self-monitoring by patients, and he'll provide guidance on how healthcare professionals can support their patients. Dr. Vallis, who needs little introduction to most of you, is a health psychologist based in Halifax, Nova Scotia. His main area of expertise is adult health psychology with an emphasis on obesity, cardiovascular risk, diabetes, and gastroenterology. He spends most of his time training healthcare providers in behavior change for chronic disease management. He is also an associate professor in the Faculty of Medicine at Dalhousie University. On behalf of Diabetes Canada, I want to thank LifeScan for bringing us today's session. And now, over to you, Dr. Vallis.
Hi everyone, my name is Michael Vallis. I'm a psychologist and I'm interested in really helping our patients get the most out of the interventions that we provide in diabetes self-management support. And I think one of the important things to think about is really, of the behaviors that we ask our patients to engage in, what are some of the behaviors that might actually be associated with the best chance of improved control? So I'd like to talk about how we can use capillary blood glucose monitoring as perhaps the standard, the baseline for which self-management support can be enhanced. The goals of this presentation are, as you see here, to help you understand the importance of meeting patients where they are by understanding literacy and numeracy and how we can take that into consideration in effective self-monitoring with our patients. Also to understand the continued relevance of capillary blood glucose monitoring in the diabetes technology landscape, and then to understand how we can support and guide our patients towards improved outcomes, regardless of the starting point of our patients. Notice that we do not have a struggle with the patients who show up ready and willing to follow through on the recommendations. It's a bit more challenging when our patients aren't so ready or aren't so willing to follow up on our recommendations, and this is the gap that we need to close. These are my disclosures and do quite a bit of consultation and support around psychology and behavior in diabetes. And when we reflect on what it's like to live with type 2 diabetes, I think this is probably one of the more important perspectives to take, that diabetes is both a very real biomedical disease for which we have a very high level of understanding of the pathophysiology of type 2 diabetes. We also have a tremendous amount of technologies and interventions to support the outcomes. But at the very same moment, diabetes is a psychosocial challenge for the patients. And this is why it's so critically important for us to meet our patients where they are. So treatment approaches really need to be individualized to the person with diabetes and where they're starting from. And I just ask you to reflect on the following. Have you ever thought to yourself that my patient's in denial? They're just not really kind of getting engaged in their diabetes care. Or have you ever felt frustrated that we're clear on our recommendations to our patients, but they don't seem to be following through despite continued support? And so the real essence is to understand how to meet patients where they are, and then importantly, how blood glucose monitoring can be a single behavior that might be a very effective way of guiding them towards enhanced self-management. In order to do so, I think the two things that I'd like to touch on today are, what do we need to know about the psychology of diabetes, and what do we need to know about how communication skills can actually help patients overcome any of the challenges that they face. And so let's start by having a brief conversation about the basic psychology that shows itself in the experience of living with type 2 diabetes. And so this is the human condition as you see portrayed on this slide. And if type 2 diabetes is primarily managed through self-management behaviors of the patient when they leave the clinical visit in the context of their home life, then, self-management kind of has, two aspects to it, which is what do I feel like doing and what do I know I should do? And here is the human condition. We are kind of pulled between these two tensions. What you know is in your best interest and what you feel like doing. Now, let's talk about diabetes or any chronic disease. What do patients want? What patients want, what they really feel like in their heart, they want to be normal. They just want to be like everybody else. They want the footprint of diabetes to be as small as possible so they can just go on with their life. What do we want from our patients? We want them to bring diabetes so close to them that they can monitor themselves and they can know what's going on. The purpose of this slide is simply to help you understand that it's not normal for people to come in super ready, super motivated, super engaged in their care. It's actually more consistent for them to want to minimize. And this is critically important in the journey for self-management support. To go one step further, I can sort of talk about general psychology by making 3 points to you that reflect really normal, healthy psychological functioning. And those points are, first, healthy behavior is actually abnormal behavior. In the societies that we live in today, the natural instinctive behavioral principles don't work. And what are those principles that guide behavior? And you see them here. Pursuit of pleasure, convenience, and immediate consequences. This is the normal state of the brain. Oh, and by the way, the most common coping response that we see is avoidance. So the most common plan A when a person is facing a struggle is to try to just hope it goes away or pretend it goes away. It's not denial. It's actually a coping strategy. And what's critically important is how do we support our patients to move forward. The second is that we know that people don't follow recommendations. They follow their own beliefs. And if we emphasize recommendations, 2 things can happen. One, they might try and fail because it's not their idea, it's ours. That leads to learned helplessness. Or they might not try. They might resist that, which is a psychological phenomenon called psychological reactance. And then finally, we know that in the human condition, emotions dominate logic. And this is because we have 2 brain systems, the frontal lobes that are the executive function, the logical parts of the brain, and the limbic system, which is that emotional part. And both parts are active. And this is where the patient-provider relationship can become so important. Now, if we accept what I'm saying about how normal it is to not follow through on recommendations, this might help you in 2 aspects. 1, reduce your frustration. And 2, really reframe from the denial to self-management support. This one is really important because one of the things that we often want for our patients is we want them to have more motivation. So it's very common, like what can we do to increase the motivation of our patients to follow through? I'd like to sort of twist this a little bit for you and suggest that is it actually our job to find more motivation, or is it our job to support people to act on the motivation that they have? And so because the brain has 2 components to it, what you feel like and what you know, most patients actually have parts of them that want good control. And they're aware of this. They don't disagree with any of this. And so if you think about it, patients on a journey, and our job is to support them in acting on the motivation that they have. This is where appreciating individual differences is really, really central. And again, I look at behavior in terms of what is the return on investment. So what behaviors would be most likely to increase a person living with type 2 diabetes to actually get the best outcomes? And this is where monitoring of blood glucose can become centrally important. And we have lots of good guidelines that help us with this. Capillary blood glucose monitoring, intermittently scanned, and real-time glucose monitoring devices. The question isn't, what are you going to recommend to your patient? But the question really is kind of, what is it that your patient can get out of these technologies? And so here's a question that I'd ask you to consider. In what ways does blood glucose monitoring improve your patient's life? And if you ask that to your patient, the answer we're looking for is the patient who's empowered. And what do we mean by that? We mean the patient who is engaged in their care, so they're active in their care, and they have a sense of urgency. Type 2 diabetes is a subtle disease. Early in the disease process, you're relatively asymptomatic. As the disease progresses, you start to run into difficulty. The key to self-management is to act early, which is this concept of urgency. And so how can we use glucose monitoring to increase engagement and urgency? Really important, because when we actually reflect on, well, how do patients understand their care? This is a really interesting study that I think has a very important result. And they just wanted to know, people living with diabetes, both type 1 and type 2, how well did they understand the concept of hemoglobin A1C? And as you see from this slide, scarily, 73.5% of the participants actually did not have a good understanding of hemoglobin A1C. And so this is a very, very important individual difference characteristic to become aware of, and it's called numeracy. To what extent do individuals understand the numbers? And the evidence suggests that numeracy is actually a problematic issue for many, many people. And so we might be really excited about some of the newer technologies for glucose monitoring, time in range, time above range, these concepts that we are really excited about, and nobody denies their relevance. The question is our patient on the same page? And how do we engage them? And for those that struggle, it may be that capillary blood glucose monitoring is actually the effective path so that we can support them in getting to the next step. How important is this? This is just simply a meta-analysis and systematic review recently published that helps us to understand that effective glucose control can actually be predicted by the use of self-monitoring. And in this particular study, they found that there was good effects, particularly for people who began with relatively poor control. And so there's some real evidence that if we can get self-monitoring onto the radar screen, it can be super important. The challenge, of course, is how do we do this? And this is where I like to think about this question. One of my favorite questions is, what's it like to live with diabetes? And I'll just kind of give you a metaphorical response to that. Many people will say it's a bit of a roller coaster experience. And, here's some evidence from a recent workshop I gave where I asked this question and we did a word cloud activity and have a look at the words. There is no positive words here. So people really don't want to have diabetes. So this is where our role to support them in the adjustment becomes so important. Now, the adjustment is critical with regard to glucose monitoring. And when we think back, we sort of understand that, in fact, this is a problem, that diabetes has often been seen from a judgmental lens. And I often reflect on this question, why did we ever decide to call it, testing your blood sugars? And we all know that one of the challenges, especially with people who struggle to follow with our recommendations, is that they often sort of look at glucose monitoring as a pass-fail experience. They sort of anticipate that if they're, not following your recommendations, then these are the outcomes. They're going to get scolded. They're going to get yelled at. And we hear this. Many people will tell us, well, I didn't want to test because I knew it was high. And if I saw that it was high, I knew this was not good. And so how do we get the judgment out of glucose monitoring? Because that may be a very effective pathway. So let's go back and think about, this woman who we're supporting on her journey. Everyone living with diabetes has got a life path in front of them, and our job is to guide them. And so then the question, really becomes is, what is the compass on your journey? And here's where I really believe that glucose monitoring is actually a very effective compass. But I'd like you to think about how we can shift from a judgment to an observation. And I'll tell you this through a metaphorical story. So I want you to imagine that glucose monitoring is kind of like driving a car. And your glucometer, in a way, is just like your speedometer. So here you are driving on the 401 in Toronto at 140 kilometers an hour. And you're going to actually leave the highway and go into a school zone where, of course, you need to be driving 40 kilometers an hour. Now, I'd like to think about how you could do that without the speedometer. Because what I can guarantee you is that when you hit 90 kilometers, you're going to think that you're kind of crawling. And when you get down to 70 kilometers, you're actually going to feel like you're actually going to be passed by somebody on the street with a walker. Because the felt experience is just such a contrast. The only way to get to 40 is using your speedometer. Imagine if we could engage patients in a way in which we're talking about blood glucose monitoring from the perspective of where they're able to begin as really feedback, non-judgmental feedback. And I will end this presentation by just emphasizing what we know about communication skills and how we can actually meet patients where they are. And I see motivational communication, as you can see on this slide. We ask, we understand the struggles the patient has, we normalize those in our summary, and we invite the patient to work together with us to achieve recommended goals. And we do that in a way in which we sort of look at our relationship with our patient in the following manner. We establish that, what we call the bond alliance. And once we've sort of understood that we're sensitive to our patient's experiences, and then we want to support them and collaborate with them, then we talk to them about the goal alliance. What are they actually trying to achieve? And once we have a sense of working together towards a purpose, then we focus on the task alliance. And we know if we start to use the concepts of behavior shaping and goal attainment, then this task alliance can be a mechanism for improving self-management control. So thanks very much for attending to this presentation, and I hope I've convinced you that glucose monitoring is an essential behavior in the support of type 2 diabetes, particularly for people who struggle.